eChart Manitoba is a secure electronic system that connects authorized healthcare providers with a summary of your health information. Dr. Tunje Fatoye has been working with the eChart since December 2010. Dr. Harold Nyoff practices at different clinics and hospitals around the province and uses eChart in his daily work to great advantage.
We were the first clinic to go live with eChart on the 6th of December 2010. We serve primarily an elderly population here, and a lot of our patients do not remember the names of their medications or who prescribed them or how long they've been taking them. They generally will talk to you about the little blue pill or the little white pill, but with eChart we can go on and look at the medication records and the prescribed medications and actually look at it and figure out which medications they're on. It's been very helpful to us all in clinic, because prior to that we used to spend about 15 to 20 minutes trying to get a DPIN faxed over to us, either from the emergency room or we ask one of our nurses to do it. But you can do this right at the point of care in the examination room. The other thing is that it's been very helpful because very quickly you can look at medication interactions and know what to safely prescribe to your patients. Say for example, a patient goes to the Grace General Hospital emergency and they get discharged from emergency and they say, see your family doctor in 2 or 3 days. They come here and they tell us they've had blood tests done. It's usually used to be a very tedious process trying to retrieve those blood tests. And very frequently we find ourselves repeating tests because we can't gain access to them. With eChart we can look them up, find them within a few minutes, and so we save the province and ourselves as a whole a lot of money and time because we have access to those tests, and we only repeat the tests that are necessary rather than just doing a whole panel of tests because we don't have access to what was done a few days prior.
I think that it'd be fair to say that in the north the technological innovations aren't quite as robust as they are in the south. Often patients don't have access to the internet. In some of the nursing stations we don't have internet access or even cell phone access a lot of the time. So I think that up north, having this ability to track my patients and look at what's happened to them is probably more of a boost than it is in Winnipeg. But I see that the technology is effective in all regions, really. The younger population almost has come to expect this type of a technology, and so they're intrigued with it, but they're not surprised by it. I find a lot of my elderly patients are very technologically savvy, and often they're quite surprised that this technology wasn't around earlier, and they're quite excited by it. I think that the product speaks for itself once we see exactly how we can access medications, immunization records, lab tests, hospital visits. I think it's almost a no-brainer once you start looking at the technology and seeing exactly what it can do for patient care.